Hi, welcome to my podcast. This is Dr. Jaime. Today I want to talk to you about something different, something new. It received the name of exosome. Exosomes are potent microvesicles released by adult mesenchymal stem cells. They have the ability to help restore cells in the body by improving cell-to-cell communications. Exosomes are not cells, and they are smaller than cells. When compared to adult stem cells, exosomes have much more growth factors, which give them a better clinical and aesthetic potential than stem cells. Exosomes improve the signaling between cells, thereby making them useful to revitalize, rejuvenate, restore, and cause anti-inflammatory effects in the body. When compared to autologous adult stem cells, exosomes have much more healthy growth factors, which give them a better clinical and aesthetic potential than stem cells. Exosomes are less complicated products to transport because the cells used in cellular therapy must be applied to the patient very quickly because they are live cells. In the laboratory, once they are found, the doctors have limited time and to apply them. However, with exosomes, they last longer because as they are proteins, they do not denature and can last for longer periods. Exosomes is a superior product to autologous treatments because they do not require surgical procedure. They come in a vial that can be injected directly, significantly reducing the risk and complications of a surgical procedure. It is a superior product to autologous stem cell therapy because the patient's cells have the same age and the same quality. For example, if a patient is a smoker and intoxicated, obviously the health of his cells is not the best. That is why the most indicated product is a donor product that is pure and free toxins. Mesenchymal cell-derived exosomes are preferably used in regenerative medicine. These cells are excellent regenerative cells due to their multipotent nature. Therefore, mesenchymal cells-derived exosomes are superior to other exosome products. This is why exosome therapy should be a doctor's first choice. In recent years, the application of exosomes in regenerative medicine has been growing. Also, many more potential applications of exosomes in regenerative medicine are still being studied. But we need to remember, exosomes are tiny vesicles that play a crucial role in cell-to-cell communication. Every cell in our body produces exosomes to give information to the neighboring cell or long-distance cells, to change their behavior or to simply share information. They transfer genetic information, proteins, and receptors, and they are capable of changing the behavior of one cell to the other. They have the ability to increase cells replication and other substances crucial for tissue regeneration. The major function of exosomes is to improve intracellular communication by releasing effectors and signaling molecules between cells. Every cell in our body produces exosomes to give information to the neighboring cells or long-distance cells, to change their behavior or to simply share information. They transfer genetic information, proteins, and receptors, and are capable of changing the behavior of one cell to the other. They can increase cell replication and other substances crucial for tissue regeneration. Exosomes affect all aspects of cell biology and are useful for improving intracellular communication. Exosomes have various clinical applications due to their high potency, reduced immunogenicity, and ability to cross physiological barriers such as the blood-brain barrier. In regenerative medicine, exosomes can be used in a point of care environment for a lot of aesthetic and therapeutic purposes. And when we talk about pain management, the exosome therapy can be used to relieve pain by subduing pain signals, reducing inflammation, and repairing damaged tissue. Exosomes can decrease inflammation, regenerate cells, and modulate the immune system. And specifically, if we talk about osteoarthritis, mesenchymal stem cell-derived exosomes can reduce the joint inflammation in osteoarthritis and also stimulate cartilage regeneration and the repair of damaged tissue. In tendinitis, exosomes can reduce the inflammation associated with tendinitis and repair torn tendons and muscles. Due to the potency of exosomes and its paracrine effects, the potential capabilities of exosomes are still being discovered and studied. Exosome therapy is the new buzz in the regenerative medicine industry because of how it can repair and regenerate your cells and tissues. Exosome therapy is safer compared to other cellular therapy because it is a cell-free therapy with no risk of rejection. Exosome therapy will be beneficial to you if you're dealing with conditions such as sport injuries, tissue regeneration, hair loss, chronic pain, and so many other complications. Well, I hope you enjoyed this episode, and we will see in the next one. Thank you.